As a primary care provider, I like to kind of think of myself as a gatekeeper to your health. There's a bunch of different reasons why I think you should have a primary care physician, but I can name a couple of the most important ones that I can come up with. The first one is if you're having a lot of different specialists you see. So say you see a kidney specialist, a heart specialist, and a dermatologist. Each of them would be ordering different tests for you, prescribing different medications. As a primary care doctor, we kind of oversee all that, make sure there's no interactions between your medications, and kind of be a liaison between the different specialists. Another reason why you should have a primary care doctor is if you happen to get sick, it's really a better option to go to someone that knows your history, knows your medications, knows your allergies, and knows what you've tried so far. It's much safer to do that than to have to go to like the emergency room or to an urgent care every time. And then the last reason is that a lot of people can feel fine but have a lot of underlying medical issues that you just don't know about. This is things such as like your blood pressure, your blood glucose, and other things like that. So it's always good to have someone just have an overview of you and just make sure everything's going on okay. So when you come to your primary care doctor, some of the things that we always look at is your vitals, which include your blood pressure, your breathing, your heart rate, and your oxygen saturation. We usually check a glucose, which can be a quick screening for something called diabetes, which is where your body is unable to process glucose. And depending on your age and risk factors, we usually screen for cholesterol as well. The first one, blood pressure. Unchecked blood pressure that is high for a long time and not treated, can lead to problems with your heart down the road. It can lead to kidney problems down the road, and it can lead to problems in your eyes that could eventually lead with blindness. Diabetes is another one. High blood sugar can be very hard on your kidneys. It can be very hard on your eyes and can increase your risk of having a heart attack or a stroke as well. So it's always good to know if those numbers are creeping up. Especially if they're just mildly elevated, there's some things that we can do, lifestyle changes, to get those down. And the last thing is cholesterol. There's no symptoms of having high cholesterol until you actually have damage from it. The big ones are vascular things, so that includes the arteries in your heart, it includes the arteries that go to your brain, and the arteries that go to your lower extremities. So we like to know like a baseline cholesterol as well. So if you are coming to see me for a well visit and you are a brand new patient, what we first do is sit down with you, spend a lot of time going over like your medical history. We get certain family medical histories since a lot of things can be hereditary. We make sure that you're caught up in all your age-appropriate screenings and immunizations, which is I'm a big component of. We make sure that you are up to date on your like if you need your flu shot for the season, or if you need your mammogram if you're a girl, if you need your prostate checked if you're a man. Depending on what sex you are and what age you are, there's different things that we need to make sure are caught up with. We would spend a lot of time going over any issues you have, any symptoms you may have, and kind of go from there. But your first visit would be a really comprehensive visit. And we would also be able to get any information and past medical history all kind of consolidated in one place. So if you need a well visit, there are usually two or three different specialists depending what age you're at. Pediatricians do well visits, so they usually see kids up until 18. Some pediatricians see kids up until 21. Family practice, which I am, we're trained to see kids from birth until adults, depending on the clinic. If you have not had a well visit and do not have a primary care doctor, there are many clinics that Tanner has. If you or loved one need to see somebody and get established, which I highly recommend, please go to tanner.org and everybody is listed on there.